Right, and welcome back. Still Breakfast Central with Olisa Chukuma and Tulokbe at Delorupalogu. Don't forget, catch us right here at News Central TV. Is where to be on Instagram and Facebook. Log on to our YouTube channel and also our website, newscentral.africa. For more, let's go straight to the big news from yesterday. Nigeria, which has received 3.94 million doses of the Oxford-AstraZeneca vaccine, COVID vaccine, through the COVID vaccine global access facility COVAX. Now, this makes Nigeria the third African country to benefit from COVAX facility after Ghana and the Ivory Coast, and the 19th African country to receive the COVID-19 vaccine overall.
The health minister, Dr. Osagie-Ihaneri, had earlier said that about 70% of the population is expected to be inoculated within 2 years. Now, COVAX, an initiative co-led by the Vaccine Alliance, Gavi, and the World Health Organization, aims to ensure equitable access to COVID-19 vaccines by dividing about 2 billion doses across 92 low and middle income countries. Meanwhile, the Minister of State for Health, Dr. Iroemeh, noted that frontline healthcare workers would be one of the first sets of people to get the vaccine.
Now, the first set of vaccines for Nigeria arrived the country just a few days after the one-year mark of the presence of the coronavirus in the country. And we'll be looking at the vaccination campaign and Nigeria's fight against the COVID-19 1 year later. And our guest is Dr. Andrew Iroemeh. And Andrew is a frontline doctor at the Landmark Isolation Center in Lagos, where he also served as the medical team lead. Dr. Andrew, good morning to you.
Hello, good morning, guys. Thank you for having me.
All right, thank you for joining us. So, Andrew, let's go straight into this now. So the much-awaited vaccines are here, 3.94 million doses. We know that they still have to go through some checks. Government has said some things with NAFTA. Can you take us through what these checks entail before the vaccination kicks off on Friday?
Well, essentially, the vaccines have to go through a series of verifications. Just to confirm, the whole idea is just to confirm the viability of the drug. So before it is administered to anybody, essentially. So one good thing is that the vaccine that we got was the AstraZeneca one. And the advantage of that, the benefit of that one specifically is that it can be stored at relatively cool temperatures, so you can store it in your refrigerator, essentially temperatures between 2 to 8 degrees Celsius, unlike the Pfizer one that has to be really stored in very, very extremely ultra cold temperatures as low as minus 70 degrees. So we have to also confirm, the capacity to store, the cold chain capacity to store them for as long as they will be on ground until they are administered to individuals. So just a bunch of series of checks, as well as NAFDAC involvement as well, to confirm that these drugs are safe to be administered to everyone.
All right, Dr. Andrew, let's talk about the vaccine rollout phase in itself for Nigeria. Now, we have frontline health workers and strategic leadership, which, if you ask me, I smile when I say that. Then there's 50 years and above, and 60 and above first, and there's also the 50 to 59 with priority for people with comorbidities, and then also the 18 to 49 years of age phase. Then the rest of the eligible population, that's from 18 years to 49. Now, looking at what we know about this virus, does this work in terms of priorities, do you think?
Yeah, exactly. So that's the basis of it also. There's something called vaccination priority. So they vaccinate people who are most at risk of contracting the virus, the infection. So essentially people who come in contact with COVID patients, people who are actively treating COVID patients. Those are people on the front line. Other healthcare workers that are at risk, seeing normal patients, but you don't know if they actually have COVID. So someone just comes and has a cough, you're not sure, in the hospital, general hospitals and all of that. As well as other frontline workers, such as the police officers, bus drivers, public workers that come in contact with the general public. Then we have age groups. So we know that with this virus, we tend to see people who are of advanced age getting more affected and suffering more debilitating illness. as compared to the younger age group. But this is not to say that the younger age group does not get infected. It's just that their likelihood of survival is higher than people who are advanced in age, as well as people who have coexisting medical conditions, what we call comorbidities, so people who have diabetes, hypertension, sickle cell disease, asthma, cancer, and all of that. So in order of the price, so those are the people that would be vaccinated first.
Okay, so let's see if we can get the form back up on the screen, and that's the form on the website of Nigeria's National Primary Healthcare Development Agency. They've been asking eligible Nigerians to go online and register. So they also say they want to use an indigenous approach for the vaccination campaign. So the strategy is called TEACH. T is for traditional vaccination campaign rollout. E for electronic self-registration by eligible Nigerians, what you're seeing on your screen. A for assisted electronic registration of eligible Nigerians. C for concomitant vaccination alongside electronic registration. And finally, H for house-to-house electronic registration. What do you think about this indigenous strategy that this agency has put up for the vaccination campaign in Nigeria?
And so the point of all of this is just to have, people follow a specific pattern so that we know who has received the vaccine and how many vaccines have been administered. But at the end of the day, it has to, so you have to understand that not everyone has the same level of literacy. So we have to also come down to a level where we are able to reach people who don't have access to technology and do all this online and electronic registration. So that's why we will go house to house, talking to people and assist people to get vaccinated or get registered to get vaccinated. So you have someone, say, for example, an old lady who lives in Badagry, a 70-year-old lady who doesn't know how to do or communicate in English or use any of these electronic methods. So we need to come to their level, to the grassroots, to assist them in getting registered to get vaccinated. But I mean, there is no perfect system, but we just have to do what we can to ensure that the people who actually need these vaccines get them.
All right. Dr. Andrew, I want to hold you on that thought there because we spoke with the minister yesterday, who was speaking live with News Central's very own Sulaiman Alede on the Village Square Africa, and he mentioned some things about the rollout. Let's take that clip first of all.
Between tomorrow and Thursday, that is Wednesday and Thursday, the NAFDAC, which is our own regulatory body in this regard, will take some of the samples and just do the routine analysis on them based on the dossier which had previously been submitted to them. And by Friday, we will then commence the vaccination, which will start at the National Hospital in Abuja. And this will commence with the vaccination of the frontline health workers. And of course, not just the professionals in the hospital, that's it, professional health workers, but even cleaners who work in frontline areas will also be vaccinated. And of course, when they are vaccinated, they will be registered electronically, and they will receive the COVID vaccination card, which is a kind of evidence that they have been vaccinated. And of course, this vaccination card they will receive has a barcode that can be verified anywhere.
All right, Dr. Andrew. So you heard the Minister of State for Health there, and he also mentioned stuff about the vaccine card that will have a barcode. What do you make of his comments?
Also regarding that, so if you it's a global project. So once you get vaccinated anywhere around the world, you are issued a COVID-19 vaccination certificate. Okay. Right. So which contains your name, your biodata, your date of birth, the day you received the first dose, and the day you received the subsequent dose. So that for the sake of forgery and people who tend to issue fake certificates or get fake certificates. The certificate has a barcode, which can be verified electronically wherever you go around the world to show that yes, you have actually received the COVID-19 vaccine. So essentially, that's what it is. So once you get vaccinated, you're issued a certificate that contains your data. You think of it like your international passport. You can use it across borders.
Okay, let's look at the states now. So we've heard that the federal government said it will give vaccines to states either by air or by road. The head of the NPHCDA also said that the country has secured the services of the private sector for ultra-cold storage facilities to help store and distribute the vaccines. I think it was earlier in January we heard from the Oyo State Governor, Seyi Makinde, who said that he was going to individually approach some vaccine makers because he believed that the number of doses coming to Oyo State were just not going to serve any point. So at this point, what role do we know that state governments are to play in this? So the National Primary Healthcare Development Agency is meant to have primary healthcare centers in every single local government area. That's 774. They're going to be in charge of the vaccination campaign at the forefront. But what about the state governments? What role are they meant to play?
Well, at this point, we need all hands on deck regarding this COVID-19 pandemic and vaccination. It's not just the federal government. We need the state government, we need the local government, and we also need the private sector. So at some point, the private sector has to come, into play. We see that now where a lot of private facilities have COVID isolation and treatment centers, which has helped tremendously in treating COVID-19 patients. So as well, in terms of COVID-19 vaccinations, we also need the private sector. The state as well, will help in the distribution as well as the local government, because the primary healthcare centers are at the grassroots level of healthcare in the country. So if they can get that, sequence, it will help, distribute the vaccinations much quicker. And I mean, it's worthy to mention that the Oyo State Governor did say the vaccine they're receiving is not going to be enough. I mean, the vaccine we receive generally is not even enough for the entire country. We received about 3.9 million doses. And bear in mind, one person has to receive 2 doses. So it's not even enough for, half or 1/3 of Lagos State. So, but it's a start. We expect more shipments to come in from COVAX, but we'll take it one step at a time.
All right. It's interesting you talked about the 3.9 vaccines coming, less than 4 million. You compare that with Nigeria's population, 200 million. So many might say it's a drop in the ocean. Many might say perhaps it's a glass half full or just a start. But we know that President Buhari and Vice President Osibajo are scheduled to take their vaccines on live television this Saturday. Now, how far do you think this will go to encourage Nigerians to take the vaccine? Don't forget, we know that you have been on the front line. So how do you think this will go far?
I mean, since the talk of a vaccine, coming out, since people, the scientists started talking about vaccines being developed and all of that, there have been a lot of skepticism, challenges, drawbacks from the general public, in terms of perception to the COVID-19 vaccine. And a lot of global leaders have come out to encourage their citizens to take the COVID-19 vaccine. And one major step that some leaders did was to take the vaccine, in public, on camera, for people to see that if they can take it. So it serves as some form of encouragement, for them as well to take it. So, I mean, it's a right step in the right direction for the president and the vice president to do that as well. I mean, they both qualify in terms of, their age, so them taking that would also encourage the general public to do that as well.
Okay. Andrew, before we let you go, we also mentioned that we wanted to look at any possible lessons Nigeria learned from COVID-19 in the country. It's been over a year now, just a few days over the year. And what we've seen is that the Nigeria Center for Disease Control and Prevention had 4 laboratories in its molecular networks. Now there are 132 labs nationwide, public and private, that can test for COVID-19. But we also seen that, according to their own websites, they've only tested 1.544 million people in a country with over 200 million people. So what lessons do you think Nigeria has learned from the presence of COVID-19, from the pandemic in the country?
Well, I hope, I really do hope, because I talk about this a lot with my colleagues. I really do hope that we've learned a lesson. I mean, it does show that we really are not prepared in terms of our healthcare sector. It needs a lot of revamping in terms of healthcare structure, in terms of availability of facilities. So more talk needs to be held regarding the upgrade of healthcare in Nigeria as a whole. Well, in terms of the figures, COVID-19 statistics in Nigeria, I mean, we all know that these numbers are underreported because there are so many cases that were not reported officially. There were people who received treatment at home. There were people who, tested privately and all of that were not documented. So the number of cases I believe that were seen or that happened in Nigeria is way more than what is officially reported. So the numbers it serves as some form of, we're controlling it, but it's out there, so people should not think that, the numbers, we'll just have this number of cases in 200 million people, we're doing fine. But there are many more people who suffer this disease and are still infected with it, both at home and both in the hospitals that, are not officially recorded. So, but in terms of lessons, I believe we've learned one or two lessons in preparedness for outbreaks and pandemics. And I hope we use that to revamp our healthcare structure.
All right. Well, thank you very much, Dr. Andrew Iroemeh, COVID-19 frontline doctor and general practitioner. Thank you for joining us on the program. Yeah, he's been still is a frontline health worker. We hope by the next time we get to talk to him that perhaps he too has taken frontline health workers. I've gone to the website too. I've tried.
Have you registered?
It was a bit of a, and I hope Dr. Andrew maybe perhaps is still watching or listening. I tried, but I couldn't really get the code. So.
Oh, okay. I got the code this morning because I went. Dr. Andrew, thank you again. So let you go. I got the code this morning, but one thing I did notice is that there's some people who have tried and they've been told that at this time they can't.
They can't.
Because depending on the information you put in, it will let you know if you are in the category. But we'll continue.
I don't expect to be eligible at this point. I shouldn't be. Fine. So if it's for the healthcare frontline workers, let them have it.
Yes.
Not when we have Buhari take it and Osibajo takes it, then the whole politicians are taking it, and
this is obviously a sore point with him, and it's also a sore point with many Nigerians. A lot of concern about that. But in the coming days, up to Saturday, we'll cover that live. Also, that today is a live edition of Village Square Africa as well, and there's a focus on the vaccinations across the continent and in Nigeria. So make sure you tune in at 7 p.m. West African time. Right now, we're going to take a quick time out. When we come back, it's security, cybersecurity. How safe is your money in your account when you're linking that account to your phone and it gets stolen? We'll have some answers for you when we come back. Stay with us.